Welcome into the Fountain Report conversation. I'm Matt Bubala, sitting with Dr. Joerg Mayer. He is a professor of zoological medicine at the University of Georgia. Thank you so much for being with us
Thank you
today.
for having me. My
We,
pleasure.
re- we really appreciate it. And I'm so excited to talk about beekeeping. So, you and I met recently and we talked a little bit. You've been working with bees, if I'm correct, since before there was worldwide concern and talk about the bee population.
Well, I wouldn't say I'm that old. Bees
I'm
have been
sorry.
bees have been under pressure for a long time, but I personally have been a beekeeper for about 20 years. So, and of course there were diseases present, but what I love, and I think what you're leading to is the pressure that the honeybee is under currently has in the recent years gotten luckily some media attention. So more and more people are talking about it, and finally it's on the radar. But even though that problem is actually a little bit older already.
Why did the honeybee population, and are we only talking about honeybees? Are there different types of bees that we're also concerned about, or is it really the honeybee?
No, it's like I think the honeybee is probably a species that we monitor, and we obviously we are, as beekeepers, we are farmers, right? So we have close contact with that species, and so if there's changes, we notice them obviously because a beekeeper working in a hive with 40,000 bees will notice immediately if suddenly 20,000 bees are missing. But the problem is actually a more systemic one. And my favorite example that I want to say is, like, I remember when I was a little kid and we did family trips in our car driving through the countryside. Every time that my dad pulled over to fill up the car, either my brother or myself, we had to clean the windshield. We had to, because there were so many insects on the
Sure.
windshield. And I don't even know when was the last time that I needed to clean my windshield of my car. And I do drive a lot too. So that alone is an indication how serious that problem is, and it doesn't only affect the honeybee, it affects all pollinators in general. But usually people don't care, if there is a grasshopper, or they may care, but they don't know if there's a grasshopper more or a bumblebee less. It's just that we manage the honeybee so intensively, and therefore we monitor them longitudinally, and we are really tuned on changes like this.
So in general, is the concern that was widespread in the media, it was talked about quite a bit in the last decade or so,
Yes, yes,
concern about the bee population.
yes.
Are we at a better place now?
Well, yes, that's a great question. So the term I think that most people are familiar with, and it went through the media, is called colony collapse disorder.
Sure.
And every time when you hear a term like this, it literally means it's a descriptive term. Your colonies are collapsing. So what that actually means, we don't really know what's going on, right? If it would be due to a virus, it would have that name. But it's what and there's a lot of speculation. Speculations have gone wild, from radiation to the cell phone towers to obviously pesticides being used to you name it. The theories are out there. What we think is going on is probably a multifactorial. So basically, multiple bad influences on the honeybee, and just basically have a synergism and are really, really bad for the honeybee population in captivity. But on the good news is that actually, because more and more people get into beekeeping, because it is a great industry and people get excited about it, and we have actually professional companies that produce bees and that are for sale. And so actually, if you just look at the number, I think currently we're having actually more bees available to us than a long time ago. So we are kind of replacing the losses with, replenishing. But the fact is still true that bees a lot of times vanish.
And we don't quite always understand why.
We don't understand why, because otherwise I think it wouldn't be that much of a mystery, because people would have put the electron microscopy to it. They would have put their gas chromatography on it. I mean, we can detect diseases really well. The problem is that with these colony collapse disorders, it's not that a beekeeper suddenly goes out to a hive and finds 20,000 dead bees. The bees are just vanished. They're just gone. So what probably happens is they're flying out, doing their pollination business, and they never come back. And so you don't literally have the body to investigate the crime.
Right. And I imagine it's not easy to tag bees like we do with other wildlife and figure out
Not
where they're
yet.
going,
Not
right?
yet. I think with the technology as advancing as it is, so our microchips are getting smaller and everything. So maybe in the near future we can tag something on a little bee and then follow it or something. But we're not, and that's the problem. We kind of lose a little bit control once they fly out. And a honeybee can fly up to in a radius of something like 4 miles from the hive. So you would have to scan a large area to try to find these dead bees somewhere.
Interesting. So you mentioned that there's companies that produce bees
Yes.
and care for bees. I imagine also more like personal and hobby beekeeping has really exploded. You see it in urban areas, you see it in suburban areas. How is that mostly for pleasure, somewhat for business? And how do veterinarians then be called upon? I would imagine because when bees get sick, you're going to naturally call a veterinarian. So what can veterinarians do to be more prepared or be involved in keeping our bees healthy?
Yeah, so the picture of the beekeeper spans from the person that just has a couple of hives in their own backyard and they just are fascinated by the topic, or maybe wanted to have their jar of honey that they can harvest from them, all the way to professional bee producers that operate maybe 12,000 hives in one operation and ship their bees literally all over the country, and everything in between. We have sideliners, we have hobbyists with maybe 200 beehives or something like this. So it ranges just like as we have huge farms available, and then we have rescue situation where they have maybe a couple cows, or just a couple cows for entertainment or something like this. So it's the same. It's the same. The way how veterinarians are going to be involved with beekeepers more and more is because until 2017, and a beekeeper could just readily go in a farm supply store and buy a bag of antibiotics and sprinkle that antibiotic easily into the beehive if they were suspicious of a certain bacterial disease that was affecting them. This was kind of a little bit an unusual situation, because if you consider the bee just like you would consider it a livestock, I call it micro livestock. So like a farmer that farms chicken, that farms cows, that farms goats, you name it, when they want to use antibiotics, they have to get what's called a veterinary feed directive, which is very similar to a prescription. And so they couldn't go in the feedlot store and say, give me 15 pounds of tetracycline. So they had to involve a veterinarian. So there was kind of like an exception, or it was just not on the radar of the Food and Drug Administration. And then eventually in 2017, they realized that, wait a second, a honeybee is a food producing animal, exactly like a chicken, like a pig, like a cow. And because we eat obviously those products that the honeybees make, so why are we allowing that farmer buying antibiotics and not regulating? And so that came to a screeching halt, and now beekeepers have to reach out to a veterinarian. And there is obviously a huge potential, a learning potential for veterinarians there, because we have a lot of veterinarians, I think, that would love to help out. But by law, the veterinarian has to be able to diagnose the disease before we can prescribe the antibiotic. So what we're trying to do here at this conference too, we were trying to highlight the possibilities, how veterinarians can actually help beekeepers, that it's a beautiful relationship. And I always compare it a little bit to James Herriot, to the old days, where he ran into the farmers, and they were kind of like, I don't know why I need you. I've been managing these kettles and my grandpa taught me how to take care of it.
Right.
What are you young veterinarian now going to tell me? So sometimes I feel a little bit like this, but it's exciting. It's really exciting. And my experience with all different kind of beekeepers, it always has been a pleasant one.
Tell me about, so we know that bees are pollinators, they make honey, they make beeswax. Tell me about other possibilities from the bee, bee
Yeah.
venom, for
Yeah,
example.
exactly. Great, thank you. And this is what I really get excited to talk about, because there is a field which is called apitherapy, and basically what that means is that if we're using any product that the bee made, and we're using that product in the healthcare of humans or animals, and this practice, the word apitherapy is actually a fairly new one. It was first used in 1935. But the practice of apitherapy goes all the way back to the dawn of civilization. So the first written documents that we have from the old Sumerians, they actually also mention how to use honey for gastric ulcers, how to use honey for wounds. And that's, I always say, this is like an easy way to experiment a little bit. If you're new to apitherapy as a veterinarian, why don't you incorporate honey in wound management? And if you don't really know, like, oh, where should I get my honey from? There is actually medical grade products available, which is clean honey, which is makes it user friendly, and it's accepted by a huge industry, including human healthcare industry.
Tell me about bee venom.
Bee venom is fascinating. So bee venom is a cocktail that consists of many, many different bioactive compounds. Most of the time when you read about it, you read about 18 to 20 components that actually help potentially deal with certain things. We don't 100% understand yet all the different mechanisms. When you get stung by a honeybee, obviously in the beginning, it feels a little bit warm, maybe the location swells up a little bit, but on a cellular level, we know now more and more, there's more and more publications out there of the enormous benefits that actually bee venom has. So for example, bee venom is 100 times more potent than hydrocortisone, which we consider a very, very strong anti-inflammatory agent. And the problem with steroids, cortisone, they have unfortunately also negative effects. So this is why you don't just want to take cortisone for a long term, or your doctor has to monitor what's going on. Versus bee venom, yes, the big problem that there would be is maybe if you are super allergic to it, and you would end up with an anaphylaxis.
Sure.
But we can test for that. We can test if you're hypersensitive to it. But there's a lot of cases in the literature where people actually were affected by a certain kind of cancer, and they got the normal traditional treatment. They got chemotherapy, multiple rounds of chemotherapy, and or an adjuvant treatment like radiation. But as you know, after a while, a cancer can potentially become resistant to those drugs that are being used in chemotherapy. So continuing with chemotherapy, is potentially not an option. And then radiation, you only have a certain dose that you give. And then you're literally kind of a little bit out of options. And you can introduce bee venom, and the bee venom has the potential, and that's why I'm looking into it. That's why I get excited, and I treat a few patients where I'm exactly at that same situation. I deal with exotic animals, and sometimes we don't, because the size of the animal, the options that we usually have for dogs, for cats, are not there because we can't find the veins because they're so small. We can't
Sure.
do repeated IV infusions, or radiation is not working. And so I've recruited quite a few patients in my study now where we talk about it's like, hey, look, unfortunately, the traditional approach to this kind of cancer doesn't seem to work in this situation. And we have two options here. We have to now focus on the quality of life. And unfortunately, this will get worse. And so we have to consider humane euthanasia. Or if you're willing to go down that path with me, we can try bee venom. And most people take me up on that offer, and I'm seeing some very, very interesting responses to it where we literally expand. I'm not claiming that I'm curing cancer with this, but what I'm after is to restore a great quality of life in the patient. And a lot of times I'm actually able to shrink the cancer down. So if there is a problem regarding a mechanical situation, that the cancer is maybe on an eyelid and the patient can't see anymore, or it's on the throat and the patient has a hard time eating, bee venom has, and I've seen this with my own eyes, and that's why I'm getting so excited. Bee venom has this amazing ability to shrink these tumors down, and then the patient can suddenly see again or can eat again. The issue is that we are not there yet. The moment
Sure.
I stop with my bee venom therapy, the tumor is just going to grow again.
Mm.
But it's baby steps, and my idea fantasy for the future would be that if oncologists really embrace that concept of apitherapy, because again, in the peer-reviewed publications, there is some really good evidence that you can use apitherapy as an adjuvant treatment. So you still use your chemotherapy, you still use your radiation, but why don't you tag on a little bit of the apitherapy? Because it has shown that it can actually protect the animal and the organs from unwanted side effects of radiation, of chemotherapy, and it has shown that it can actually works in synergy with the chemotherapy and actually is more effective in shrinking the cancer or increasing survival.
That's really exciting. I imagine a lot more study to be done
Oh yeah.
to see where that will go.
Oh yeah, I'm really excited about it, and I'm focusing my professional energy right now 100% onto this topic because I feel this is so exciting. And it what I love about it, it's like that this kind of therapy is available all over the world. It's very cheap, right? We don't have a medical grade honeybee, uh, and so it seems like the bee venom is fairly highly conserved. Yes, there could be a little percentage from that ingredient lower in this, but overall, if you get stung by a bee in China, you more or less get the same cocktail injected than in Brazil, than in Florida. So that's the very cool thing. And like I said, it's ready available and it's fairly cheap. We just need to work on the knowledge, how it works, why it works, and then obviously find, the limits of, because the rule number one that we always want to operate under is like do no harm. We don't want to make a situation worse.
Of course.
And in my situation, and I'm getting more and more emboldened using these different concepts of apitherapy because I don't really see negative side effects, which is really amazing.
Dr. Joerg Mayer from the University of Georgia. That's fascinating stuff. Thank you so much for being with us.
Oh, thank you so much for having me.